This is Carolina Business Review. Major support provided by High Point University, the premier life skills university focused on preparing students for the world as it is going to be. Blue Cross Blue Shield of South Carolina, an independent licensee of the Blue Cross and Blue Shield Association. Sunoco, a global manufacturer of consumer and industrial packaging products and services with more than 300 operations in 35 countries.
By most accounts, it's been 16 years since a real recession and a real bear stock market. Welcome to Carolina Business Review. I am Chris William. Just because it's been 16 years does not mean a recession or a bear market is imminent. However, odds do increase when we get that far out on the statistical distribution scale that economists call it. Right around the corner from spring now, and business, policy, and politics are in full bloom and in full form in the Carolinas, and we're going to discern as much as we can in the next 30 minutes or so. And later on, he is about 60 days into the new job. We are joined by North Carolina's new Department of Health and Human Services Secretary, Dr. Dev Sangvai. Stay with us.
Major funding also by Foundation for the Carolinas, a catalyst for philanthropy and driver of civic engagement, helping individuals, nonprofits, and companies bring their charitable visions to life. Truliant Federal Credit Union, proudly serving the Carolinas since 1952 by focusing on what truly matters, our members' financial success. Welcome to Brighter Banking. And Martin Marietta, a leading provider of natural resource-based building materials, providing the foundation on which our communities improve and grow. On this edition of Carolina Business Review, Jessica Helms from the Charlotte Area Chamber of Commerce, Carl Blackstone of the Columbia Chamber of Commerce, and special guest, Dr. Dev Sangvai, Secretary of the North Carolina Department of Health and Human Services.
Hello, welcome again to our program. Thank you for joining us, Carol. Why am I having this kind of trouble? This is about our fifth restart. We're not going to restart. Carl, Jessica. It seems like I need a little help on cue cards, but welcome again.
Great.
Good to see you both.
Good to see you.
Good to see you.
And,
Thank you.
and Jessica, welcome to the dialogue for the first time. We're glad to have you here. Carl, I'm going to start with you before I mess this up one more time. The idea that we're 16 years past any real slowdown, we've had a steam going for years, certainly nationally, but in the Carolinas. Are you getting any sense, if you can tease out any anxiety around tariffs in South Carolina or any of your members, are you getting any sense that there's a real slowdown in the offing?
I think there was a huge, not significant slowdown, but a slowdown last year during the election time, and now as things start unraveling a little bit in D.C., as things play out, there is a little bit of slowdown. But it's hard to really see what is a slowdown when you're growing so fast. And the Carolinas are just seeing significant economic boom throughout both states. I think if it does slow down, it will be a small thing, but I don't really anticipate anything significant.
You know, don't want to go back down this road too far, but even in the last slowdown, 08, 09, 10, it was ugly, it was hard for everybody. But it seemed the Carolinas were less coupled with the national hurt that went down. Is that fair to say?
I think so, and I think there is some regionality to this. I think other places around the country may feel a little worse than we are. The growth that they're seeing here in Charlotte, this growth that they're seeing in Charleston and Greenville, even Columbia, I'm not too worried about it.
Is there a dark side to growth?
A dark side, I don't know about that. And
Higher
we're seeing
prices or
close to 100 people a day moving to Charlotte, so maybe traffic, but.
Growing pains are significant wherever, any type of environment. I think what we're all seeing we just have to deal with different set of challenges than we've had. So maybe not a dark side, it's just you got to refocus a little bit and think more strategically on how to deal with the growth.
Mm-hmm. Mm-hmm. Are you, so the same thing for you, Jessica, when you talk to your members, when you convene groups and talk about in Charlotte or the Charlotte region for you, how do you tease out anxiety around maybe policy and politics versus what's really going on in the economy?
We hear from our members there's still a lot of growth happening. There are new businesses starting every day. We did, as a chamber, 57 ribbon cuttings last year alone. So there are a lot of new businesses coming to Charlotte and still opening and still growing. And so I'm not seeing a slowdown. People might be tightening their budgets a little bit, careful with expenditures, but not significant.
Is there a, when you, some of your members, obviously small business, mid-sized businesses, what's the biggest barrier to growth? Is it still financing?
It is.
Yeah.
Yes, access to capital, financing, even finding affordable office space. We've seen that. There's a big launch of co-working spaces to try to accommodate that.
What about jobs? Jobs, hiring?
We're still struggling to keep up with job growth. It's now rethinking about how do we take, as we transform our market, how do we retrain employees? How do we get kids that are graduating school interested in advanced automation, manufacturing jobs? And the pool is getting a little smaller. This is the first class, you mentioned the recession. This year, graduating seniors were born in 2007. And that was 2007, 8, and 9 were significantly smaller birth rates, the lowest since World War II.
Oh, good point.
So we are finally seeing the pipeline is starting to get a little smaller. So we have to be a little bit more creative in how we get people straight into the workforce.
I want to hit the transportation issue quickly because you mentioned it, Jessica, and also places like Charlotte and the Charlotte region, the Low Country, upstate South Carolina, certainly the Triangle. Traffic is becoming horrendous, and that's not a very technical term, but is the Charlotte transportation debate around the transportation plan, is it moving ahead? Do you feel like that city, your region, is going to have an answer to that?
You know, it's funny, one of our members recently joked about it and considered the plan to be moving from this is absolutely never going to happen to there's a possibility that this is going to take place. So we are seeing some movement around that. The Charlotte Area Chamber just had a public policy meeting, and we were talking about I-77 and some of our major interstates, and a way to have managed lanes is the plan within that transportation package, and what that looks like, because funding seems to be the major issue with some of this plan and getting things off the ground, but it's a long process.
Yeah. Oh, there's no doubt. South Carolina, Low Country, a major development in, no pun intended, but literally real estate development, is the South Carolina ports sold a major parcel in a historic part of the District of Charleston waterfront for $250 million or so. We get the sense to Ben Navarro. That's been in the offing for at least a year that we know about. It's a big monetary deal, but it is a big developmental deal for a town that's historically not in my backyard or front yard. I don't want any change. How does this unfold?
I think it's a great opportunity for both the state as well as for Charleston. You've got the state selling an asset, but frees up capital for them to put back into infrastructure for the Ports Authority. So that's a win. Secondly, you get a Charleston fella who's grown his business there, who's been a great developer, investing in Charleston Place, the tennis center, built a world-class charter school in the inner city part of Charleston. Ben's been a great corporate citizen, so I think this is a win for the development as well, because you get a local guy who really wants to do it right.
Yeah, not to go down that road too far, but how much that Ben is a local, quote unquote, had to do with them accepting and approving whatever that looked like. And not just the ports in Barbara Melvin, but the community has a larger say in that, of course.
I think it speaks to the previous deal that was being considered from somebody out of town, out of state, and I think they feel a little bit better that this will be managed in a way that's respectful of what Charleston historically has been. So I think this is going to be a win-win.
Okay, thank you both. Stay with us. We're going to bring our guest on in a moment. Boom Supersonic, that may ring a bell, announced up in the Triad of North Carolina as being the next phase, the next development of high-speed supersonic personal air travel. We're going to have the Chief Executive Officer on from Boom Supersonic. His name is Blake Scholl. He will be on this program. Also coming up, he is the Attorney General in South Carolina and has also been on this program before. Alan Wilson joins us again as well, right here on this set. There is nothing like a well-made, deep state, political national intrigue thriller to stream on Netflix or Prime or any streaming services. But as close to that as our current state may seem, we're talking reality now. And our special guest operates at a very high level of political leadership, certainly in the state, but it also can be politically charged, but yet is directly responsible for citizens' everyday mental and physical health, among many other important things. He oversees a complex agency with 18,000 employees, plus or minus, annual budget of about $38 billion. Joining us now was family medicine doc, university professor, hospital administrator, but now North Carolina's Department of Health and Human Services Secretary, Dr. Dev Sangvai. Sangvai. I keep getting that wrong, and you've been so gracious about this offset, but thank you, Dr. Sangvai. It's good to have you here on the program.
It's great to be here. Thank you for having me.
Thanks for letting me go through that, because that was tough. You are now on the inside of HHS. You were a hospital administrator. You were a doc. What's it like to be on the inside when you pull back that veil? How is it different?
Yeah, Chris, thank you for that question. You know, I've been a part of the healthcare landscape in North Carolina for over 20 years, and I've had different sorts of interaction with HHS. As a doctor, I got to see what it meant for my patients to get Medicaid that previously didn't have Medicaid, and then certainly many of the human services. What I've been most impressed by, and maybe shouldn't be so surprised by, has been the people who work for the agency. We got a remarkable group of individuals who are committed to the work that they're doing. Earlier you were talking about labor shortages with the other guests. We're facing some of that as well. So I am really impressed with the number of people in the agency who come to work day in and day out in service to the 11 million people of this state.
You've got, and you had mentioned in a recent interview, Your Honor, that there was 20 to 23% openings of jobs, postings within the agency. Is that a liability? Is that punitive to you?
It's not punitive, but it does create challenges, because when you do have that 23% vacancy rate, you have to make priorities. And our priorities have really been to make sure we put people first, to make sure we're serving those who are most in need of of the services we provide. But it is a challenge, and we're mostly seeing that in our state-run facilities. It might surprise many people, but we actually run hospitals in North Carolina. We have about 10 treatment facilities as well. And those areas where we directly take care of patients is where we face the greatest labor challenges.
Carl, question?
Hey, thank you. Nice to meet you, Mr. Secretary. Looking out years, we're seeing so much automation. AI is just really in a stratospheric growth mode here. Where do you see healthcare, and how can AI help you run a large system, but what's the impact it has on access to healthcare?
Absolutely. That's a great question. Thank you, Carl. As a bureaucracy, as an agency, and one that provides healthcare services, there is so much administrative burden, and there's a real opportunity for responsible AI to help us de-burden individuals who are on the front line, so that if you have capacity, you can optimize the use of that capacity. There's an opportunity to think about automation with respect to some of the work that we do around enrollment and many of the other things that we do. So as we have that labor shortage, as we have that vacancy rate, I'm optimistic that we can use technology tools to help close some of that gap.
Does that help? No,
please.
Does that help from managing the roles of who's on Medicaid in North Carolina and South Carolina?
It could. Right now that process is still very manual, determining who's eligible, making sure that those who are eligible continue to tap into those benefits. But as we've seen, AI has so much potential and possibility. I'm really optimistic that it can help not only on the clinical side and the services side, but those back office administrative functions as well.
Right, thank you.
Jessica?
Yes, Dr. Sangvai, it's nice to meet you.
Great to meet you.
What is the DHHS doing to help with our small business community, helping to lower healthcare costs and making it affordable for employers?
Yeah, that's a great question. There's no secret that healthcare costs are going up and up. One of the most important things, I think, for small employers is the work we've done around Medicaid expansion, because we know many individuals who currently have Medicaid in North Carolina are actually working, but they're working in settings where their employer is unable to offer employer-sponsored health insurance. So by continuing to have a robust Medicaid program, supporting the type of expansion that we've had in the state of North Carolina, what we're able to do is to keep people healthy, so they show up to work, they're able to be present, it decreases your absenteeism rate. So there is a direct connection between the small employer and Medicaid, and it's often a connection people don't make.
I want to follow up on that. One of your stated priorities is improving access to health care and creating a healthier North Carolina for all. Where are we most unhealthy in the state?
Yeah, that's a great question. I think it's really around chronic disease. We have so much opportunity to help individuals manage chronic disease, diabetes, heart disease, some of it's tobacco use. If we can find a way to ensure that individuals are getting early access to care, particularly primary care, we can deburden the downstream utilization. As a family doctor, it's always going to be about prevention. From the perspective I'm coming from, prevention costs less to the employer, to the state. You get better outcomes, you have decreased downstream utilization, so we really need to focus on prevention.
What's been the biggest barrier to hit the chronic disease where you can make the most effectiveness?
Yeah, there are a couple of barriers. I think one is access. You know, we have a state that's largely 80% rural, and so being able to access those direct primary care services has been a challenge for many North Carolinians. We've been fortunate, even with our Medicaid expansion, though, that we haven't seen a pent-up demand or a demand for those services. So if we can get individuals Medicaid, we are able to get them to their doctors and to other healthcare providers. But it's really access in the rural communities. And then the second piece is addressing those things that aren't directly related to healthcare in the classic setting of services, and it's really around these health-related social needs. You may have heard them sometimes described as social drivers of health. We also need to make sure that individuals have access to food, nutrition, transportation, those things, because a heavy investment in that, a solid investment in that, it really augments primary care, and again, keeps people healthy, so you have less utilization of that more expensive downstream care.
Mm-hmm. Cool.
We're seeing, at least in South Carolina, a significant trend towards the hospital systems getting larger. Lots of M&A work, lots of consolidation of hospital systems. It's been true in North Carolina as well. What is the answer? How do you continue to get access? Telehealth has gone a long way, especially since COVID, but how do you get to those rural communities? And do we need to start looking as an economic development type of model of incentivizing large healthcare systems to go into more rural communities?
I think it's all of the above. For the rural communities, if there is a community hospital, we have to do everything we can to support that hospital. I imagine it's the same in South Carolina, but certainly here in North Carolina, where we have those smaller hospitals, we have to definitely figure out how to support them. They are surviving on razor-thin margins, and often those margins are dependent on providing care to individuals who have insurance, oftentimes Medicaid. So I think one of the most important things we can do is to ensure that individuals who do go to those hospitals have some form of insurance so that the hospital can get reimbursed, have a healthy enough margin to continue to do what they're doing. It's another way to really think about how important Medicaid really is, because it supports that hospital. And as you know, sometimes it's the most important employer in some of these smaller areas. So the downstream impact can be felt pretty quickly. If that hospital isn't stable, if it isn't solvent, it can't keep the labor force it needs, it can't continue to hire, and then you can see what the impact can be from there.
Mm-hmm. Jessica?
In Charlotte, we're seeing an increase in concierge, small private health service businesses. And so how can the business community collaborate with DHHS?
Well, there are a number of ways that you can collaborate. Those concierge practices are great because they offer a particular type of service to individuals who can access them, and sometimes it's quite honestly just being able to afford those types of services. I think what we really need from the employer community in North Carolina is really support for some of those key things that we're doing at HHS. I keep going back to Medicaid, but that's so important for what we do, because if we can continue to have a stable Medicaid program, and sorry, I think the best one we have is in North Carolina. Maybe the second best is in South Carolina. If we can continue to do what we have, I think what that does is it creates a healthy workforce. It allows them, like I said earlier, to come to work, to be present, but it also allows us to ensure that we get the downstream economic impact. By some estimates in North Carolina, the Medicaid program adds around $28 billion to the economic impact. So that's in the provider side and other related services. So it's not too hard to connect the dots.
Has it become more complicated to have the discussion, as you're talking about it now, Medicaid, when Medicare and Medicaid are being debated so hotly on the national level?
It can be. You know, the good news for us, though, is that up until now, there doesn't seem to be a whole lot around what's going to happen with Medicare. At least at the federal level, we don't hear as much around cuts. And so some of the opportunities to reduce cost, we see that more focused in the Medicaid space. But at a very basic level, we sometimes have to spend some time educating individuals on the difference between Medicare and Medicaid.
Yeah, sure. I want a quick follow-up. Your at least two predecessors, Dr. Cohen, Dr. Mandy Cohen, and Secretary Cody Kinsley, both were very big proponents for mental health and the deployment of mental health and the development of mental health. You seem to be in that same vein. How do you become a champion? How do you deploy the kind of mental health attention that you think is needed?
Yeah, thank you for that question. For me, it really comes from when I was taking care of patients. So many of my patients had behavioral health and mental health needs. It became very easy to be an advocate in that space. I think what we've done in North Carolina is truly remarkable. We've invested $835 million in behavioral health. A good chunk of that is to ensure that mental health providers, behavioral health providers have rates, compensation, reimbursement that allows them to be competitive enough to be able to open up their offices and open up their practices to see patients. But it's also making that investment in the community. So a balance of that money has really been invested into the community, to how you prop up community-based resources to ensure that it's not always bricks and mortar or even tele, but you have the kind of services in the community that you need.
Mm-hmm. Carl?
If you've got one of the largest state agencies, you've got such a huge economic impact with what your agency works on. What keeps you up at night as a physician, but also running such a large institution?
Yeah, that's a great question. We are an agency that, as was mentioned, is about 19,000 employees, a budget of around $39 billion, and 33 divisions within that. And we cover everything from Medicaid to food and nutrition to the licensing of facilities. So there are a lot of things that keep me up at night. I think one of them is that I really want to make sure that the programs and services we provide really reach all North Carolinians. And what gives me pause is when we're not able to do that. And so it's easy to think at the macro level, but what really keeps me up is when you think at the micro level, the individual that isn't able to go see the doctor, isn't able to fill that prescription, or in some cases isn't able to access their food and nutrition benefits. Because it's easy to think at a big level, but fundamentally at the individual level, we want to make sure we don't fail.
Yeah, and let me do a quick, I hate to jump in line ahead of you here, but we're going to run out of time, and I want to follow on the heels of that. So to that point, when you argue your point to those who make law, to policymakers, and you are the chief advocate for the health in North Carolina. So how do you include everyone in the General Assembly and have them feel the passion of what your argument is that you're making here
That's
now?
a great question. You know, first of all, I feel that they have the passion. In my 60 days of having an opportunity to meet with many of our elected leaders, they too feel passionate about it. They too feel the importance that this has for their constituents. For me, it's really focusing on the facts, keeping them basic and simple, ensuring that we're able to communicate that in a clear and concise fashion, and then reintroducing those facts, because sometimes it doesn't just end with one conversation. But I truly believe in our state that when we look across both the legislative side, the administrative side, everybody really wants to be a part of the solution.
Mm-hmm. We've about a minute and a half left. I want to get to, immigration's, again, hotly debated. In the policy, as far as I can tell, sir, is the idea that in North Carolina, Health and Human Services will address undocumented immigrants through emergency medicine and related services. I'm sure you want to expand that because you seem to be a guy with heart. How do you support the undocumented now, given that it's become such an acute debate?
Yeah, you know, I look at it this way. There are 11 million people in the state of North Carolina, And we serve individuals who live in rural communities. We serve individuals who live in urban communities. We have programs that are specifically designed for disabled. We have programs that are designed to help individuals who are aging, veterans, children, and others. My focus is really on what do we need to do to ensure that our programs and services are working for all.
Does the General Assembly support that in principle, do you feel?
In my conversations, it's been pretty consistent that individuals really want to see what we can do for the best of North Carolina.
Dr. Sangvai, thank you for taking time. I mean, you've got a job ahead of you, and I know you know that, but clearly your passion is coming out. And our best to you. I hope you'll come back, because I know you hit the ground running across the state.
I appreciate it.
Yeah, thank you very much for joining us.
Great, thank you.
Yeah, Jessica, I hope we didn't scare you off. Please come back.
Thank you. I appreciate it, Chris.
Thanks for being so open too. And Carl, always good to have you.
Great. Thank you.
Thank you for watching our program. If you have any questions or comments, we would encourage that. Go to carolinabusinessreview.org, watch past programs, make comments, and join us again. Coming up on several programs, but thank you for joining us. Until next week, I'm Chris William. We hope your weekend is good and that you have a happy spring. Good night.
Gratefully acknowledging support by Martin Marietta, Truliant Federal Credit Union, Foundation for the Carolinas, Sunoco, Blue Cross Blue Shield of South Carolina, High Point University, and by viewers like you. Thank you